Hi everybody, it's Nurse Jill, and today I wanted to talk to you a little bit about preeclampsia during pregnancy. And you may not be familiar with the term preeclampsia, or you may have heard it called toxemia before by your doctor. But either way, preeclampsia can happen during pregnancy, really at any time and without warning. So, even though you may have never had an issue with high blood pressure, you may encounter that during your pregnancy just as a reaction that your body is having to pregnancy. Well, the signs and symptoms to look for are a cluster of symptoms. So, you might start to get a headache. And when I say a headache, I'm not talking about a headache that you can take some Tylenol, lay down, and feel better. This is a headache that I have heard described as a severe pressure in the back base of the skull, and it feels like there's so much pressure in your head that your head's going to explode. I've also heard it described by clients that it feels like somebody is hammering a nail into the back of their head. So this is an extreme headache. Along with that, you may experience spots in your vision, blurry vision. Your face may puff up and your hands may puff up. So it's normal to have some swelling in your feet, but not quite as normal to have the puffiness in your face and your hands. But the key here is most of the time with preeclampsia, you're going to get this cluster of symptoms. So if you have 1, 2, 3 of these combined, then you know that something is not right. Now, along with these symptoms, you might have some sharp pain in your abdomen and maybe some bleeding. So we want you to get to the hospital just as soon as possible if you feel any of these symptoms. Call an ambulance or get yourself to the hospital ASAP. Don't ignore them, because preeclampsia means pre-eclampsia. So if you ignore these symptoms, then your body is going to go into eclampsia, which will put your body into seizures and organ failure, and possibly could be fatal to you and the baby. So you don't want to ignore these symptoms. You just want to be aware, because if you know the signs and symptoms of preeclampsia, then you can get the help that you need. Now, most of the time, delivery is the only option to cure your preeclampsia. So if you feel any of these symptoms, please go straight to the hospital. Okay, until next time.